some background for those that are listening, and that is David is a type 2 diabetic that they wanted to put him on injections of insulin. And the reason he's here is to prevent him from going on insulin, because we know that is when the doctors are out of bullets. They don't know how diabetes works, and they put you on a drug that's only going to make you end up eventually on dialysis. And what he was going to the doctor for was for debridement, meaning getting rid of the scar tissue and cleaning out the wounds on his foot so his own body could heal. David's going to talk about a mistake that a doctor made, saying that he had cellulitis and needed to go into the hospital during Christmas and get IV drugs. And here's a picture of the difference between a leg with cellulitis on the right and without on the left. It's a bacterial infection of the skin, and if it's left untreated, it can lead to a very serious and life-threatening blood infection. And David was smart enough to be the CEO of his own healthcare and get a second opinion. Can you explain the test that they did to determine it was not cellulitis?
At the other doctor's office, they never put my leg up. They had me in a chair with my leg down. Well, it turns red when that happens. It had been down for many hours. Well, when I got to Dr. Robinette's office, got me in his chair that puts my leg up and my whole body up in the air, turns you back and your legs in the air. And it turned just as white as it could be. And he just sat there and he said he hates it when, two doctors have different opinions. But he said, you do not have cellulitis.
So this is what David actually has. It's called peripheral artery disease, and it's very common with type 2 diabetics. It's when the arteries become blocked and it reduces the blood flow that is going from the heart down to the extremities and also from the feet back up to the heart. So you see on the right leg here with this diagram, there are deposits inside the artery walls that are causing a narrowing of the blood flow back to the heart. So gravity, of course, is making it easy for the blood to pull into the lower extremities. When the leg is in a downward position, as David was when he was sitting for hours at the first doctor's office. So all the doctor had to have done was to put David's leg in this position here in order to see that the blood could flow back to the heart, thereby ruling out cellulitis. So let's repeat. When your leg was down and it was red, it looked like cellulitis, but when they put it up and it turned white, that was proof that it was not cellulitis.
It's called dependent rubeus. He was looking at it and he said, this is the best your leg has looked, and I can't remember when. And the doctor said that. Dr. Robinette did. A physician that was a podiatrist, a very good doctor. I mean, very competent physician. What I've been having recently with diabetic problems is going to the hospital. I'll have 3-4 different doctors. When you start getting over 2 doctors, I think you got problems, because there's no way they're going to be seeing each other. There's no way they have time to read all the chart and sit down and make a cohesive judgment. Too many cooks in the kitchen.
Also, you are blessed that you have Frida. She's your patient advocate because she's your wife. She shows up with you. But what about the guys in here that are single? They go to the hospital. They've got to be their own advocate.
That's
And
right.
what happens when they're knocked out? Who's their advocate then? That's an even scarier thought. Now, here's my thought on the doctor that gave you the wrong diagnosis. Rookie mistake doctor. The way your foot looked, he made a judgment call out of fear. So he puts you in the hospital so that way he washes his hands and goes, that patient's not going to get me out of my Christmas dinner. I'll just put him in the hospital on an IV drug and make my life easier. And what does he do? He's covering his ass. Or CYA, cover your ass. But is it good for you to go in the hospital and be on IV drugs? No, it damages the gut biome. In the doctor's defense, the rookie doctor, they're working on the side of caution. But what the problem with that is that side of caution causes a lot of collateral damage. And this is the difference between the body when you throw antibiotics intravenously in the body. And those antibiotics that we're going to put in David aren't going just to his foot. They're killing everything in sight, leading to more problems, which the rookie mistake doctor didn't know your case history well enough also in order to make the right diagnosis. Your
Right.
other doctor knew. He said, this is the best your foot has ever looked because he's been following you
Yeah.
over time. And guys, this is where it comes into you have to be your own CEO of your healthcare, because when you go into the healthcare system, you don't know who you're going to get that day. You may not get somebody who knows your history, so you got to take charge.
You are just so right. You are just so right. You've got to be able to take care of your own health care. We're doing a lot better. I'm happy and grateful for all your input and all you do. You just don't know what it means to me.
I share this because I want you guys to realize the reason you are learning about how your own body works is so that you can use common sense and put two and two together. Because if you end up with a doctor who makes a rookie mistake, then you could end up, unfortunately, getting put into the hospital with intravenous antibiotics that do more harm than good. So hats off to David for making it through this sticky situation, and I hope you all can learn from it.